So how do you fill that void? So how do you use your musculoskeletal abilities in the neuro, and how does it work?
The clinical classification system used in MDT may be utilized on neurological patients who experience pain or present other symptoms triggered by these mechanical problems. Let's describe a picture of neurological patient, for example, a stroke patient. Okay, when we analyze stroke patients, generally they present great functional disabilities. They have gait problems, upper limb impairment, sensory impairment. So the majority of the activities of their daily living suffer great impact. When I present to you this picture of the neurological patient, pain seems to be left in the background. But why? Well, because the therapies are focused on improving this condition that are devastating for the patient, not being able to walk, not being independent to move the arm. Now, pain can be a problem affecting this situation, but there are other symptoms not necessarily present as pain, but they are set off by a musculoskeletal problem. For example, spasticity, as we are talking before. So expect when we're talking about hemiplegic shoulder pain, where pain is at the center of this scene, when a neuro patient presents low back pain, neck, knee, or ankle pain, these problems seem to be self-reported in the research literature. Let's move the neurological condition of the patient from this scenario we are describing. For many, many years, a great number of musculoskeletal conditions which generate pain have been treated without a suitable classification. This shows us the first problem. Now, what's the second problem that the musculoskeletal area faces nowadays? That there are still a lot of investigations being produced that don't take into account the problem I just described to you. So we have two big problems. Still with the neurological condition out of this scenario. Just presenting one condition, the musculoskeletal condition. We see how there is in a major problem for musculoskeletal population. For example, first, increased use of medication. Patients seeking and adopting alternative therapies which are not evidence-based. Increased negative beliefs and more individuals presenting chronic pain. Now, let's bring to this problematic scenario all the conditions we mentioned on the neuro patients, when the pain is self-reported or specific neurological symptoms are being misinterpreted. I know this doesn't sound very encouraging, right?
I mean, it sounds like we are trying to separate conditions and classifications, so it's hard to combine them. I think we are trained very specifically to neurologic, that musculoskeletal is something completely different. So I think our minds are trained just in one thing and we cannot see the whole picture. So
yeah, for this reason, we need to use a system that has an order. Okay, that allow us to line up the pieces in the chessboard, you know, where the clinical presentation of the patient is the place. So we need to know which pieces to move to get the place we want. This is why MDT, I think, fits perfectly as a diagnostic system. MDT fits perfectly as a sanitary technology, because it follows a procedure, it's a standardized, it's evidence-based, it's low cost because you only need an MDT trained professional. And it's a tool that can be applied to different populations. Other sanitary technologies are very expensive and seem to be innovative, as they have lights and make sounds or generate reports in real time, you know.
Technology.
Well, Well, the fact is that these technologies do not necessarily have the support of the scientific evidence to be used. These technologies don't educate our patients. Can you see where I'm going?
Yes, I can. I'm liking, keep going.
Other fields in physical therapy have very good subclassification systems. We can see this in the respiratory physical therapy or vestibular rehabilitation, in which peripheral and central problems are well identified. These lead to the use of very precise treatment strategies adjustable to each patient. When we have this, patient prognosis become clear. You know, prognosis is getting better in the musculoskeletal field, but for neurological patients, that's very difficult. You know, okay, except in a spinal cord injury, because the neuropt have the 𝐏𝐴 scale. In the another neurological conditions, it's very hard. My focus all this time has been to use McKenzie method to get a better understanding and try to subclassify the symptoms of the neurological patient. This, I believe, might help us have a better understanding of this amazing chess game. You know, it might seem simple to apply MDT in neurological patients. One may think it's only a matter of grabbing an assessment form and assessing a stroke patient to see if there is any mechanical problem. But however, from my point of view, it's not that simple.